Hello everyone, welcome to this MedTwins video. Today we're going to be talking about pancreatitis, which is definitely a very important topic as a medical student because they really like to ask about it, but also as a doctor because as we're going to see, has many complications and it can be a very serious condition. So yeah, let's begin. So in this video, we're going to first talk about an overview of the pancreas and pancreatic physiology very quickly, and then we're going to talk about epidemiology, which isn't too important when it comes to pancreatitis, as we just got to think of the causes. And yeah, causes are definitely very, very important, which is what we're going to talk next. Then we're going to talk a bit about the pathogenesis as well. The pathology itself, we're going to talk about mostly how alcohol and gallstones cause pancreatitis, which are the most prevalent when it comes to causing pancreatitis. We're going to discuss some signs and symptoms and how you can identify someone who's having pancreatitis. We're going to talk about how it's diagnosed, also some complications. There are several complications that can be potentially very severe, so complication is definitely very, very important. And then we're also going to talk about treatment. Treatment, again, obviously very important. So yeah, let's begin. So to start off, something very important for us to clear up about the pancreas, at least pancreatitis, is that pancreatitis, it is autodigestion of the pancreas. So as we're going to talk about in a second, the pancreas secretes several enzymes that play a major role in digestion of food. And for some reason or another, these enzymes can become activated too early or activate inside the pancreas itself, which will cause them to break down the pancreas. So I put an image of a sad pancreas for you to remember this. And let's talk a bit about the function of the pancreas itself. So the functions of the pancreas can be divided into two: the endocrine functions, here endocrine, and the exocrine functions, exocrine. Exocrine are more important for us in this video as they're the ones that have most to do with pancreatitis itself, while the endocrine functions are mostly involved in diabetes and some other conditions of the sort. So the endocrine pancreas secretes important hormones such as insulin, which is its main function is to decrease blood sugar among other functions, glucagon, which its main function is to increase blood sugar among other functions as well, somatostatin, which is basically a reset button, pancreatic polypeptide and amylin, which have other functions as well. But the exocrine pancreas, which is what we're going to be focusing on for the rest of this video, secretes several important enzymes in digestion. So amylase, it's important to digest amylose, which is a very important carbohydrate. Lipase, which aids in the digestion of fats. Colipase will help lipase do its function. So colipase also helps in the breakdown of fats. Trypsin, which is very, very important for this video, that's why it's highlighted in red, it's a protease, so it helps break down proteins, just like elastase, chymotrypsin, and carboxypeptidases as well. But the pancreas can also secrete water and bicarbonate, which is important to neutralize some of that acid coming from the stomach. It's not the only organ that will secrete this. The gut wall can also secrete this, and there's also some glands in the duodenum that can secrete this, but it's also definitely important. So these enzymes play a major role in the digestion of proteins, and because imagine them as almost like grenades that you need to pull a pin before activating them. So these are called zymogens. They are secreted in an inactive form, and then inside the intestinal lumen, they're going to become activated. So the pancreas produces trypsinogen, which is the inactive form of trypsin. And trypsin, in order for trypsinogen to become activated, it needs to go into the intestine and interact with enteropeptidases or enterokinases. And these can then activate trypsin. And trypsin is definitely the most important because then trypsin itself can activate more trypsinogen into trypsin. And it can also activate other proteases like the ones I showed you in the previous slide, like the elastase and chymotrypsin among others. So it's a positive feedback loop where trypsin is activated by enterokinase or enteropeptidase, and then trypsin itself can activate other enzymes inside the intestinal lumen to aid in the digestion of proteins. So just highlighting this again, it needs to be activated to work. So trypsinogen in active form is activated into trypsin. And this image, I got it online, it helps a lot as well. So enterokinase, this is a brush border enzyme. It stays in the top of the small intestine epithelial cells, and it will activate trypsinogen to trypsin, and then trypsin itself can help activate more trypsin, and it can also help activate other enzymes such as chymotrypsinogen into chymotrypsin, among others. So when it comes to the epidemiology of pancreatitis, it is a bit complicated. Uh, just think about the causes really, because it can happen to anyone. So think of the causes. There's a mnemonic called I get smashed, which you can see down here. It's broken down. We're going to talk about it later as well. But think about the risk factors, mostly alcohol and gallstones. These two are the main causes of pancreatitis. So anyone who drinks a lot, or anyone who has any of the risk factors for gallstones, such as being females, being on any sort of hormone therapy, increased cholesterol, and things like that, can increase their risk of having acute pancreatitis or pancreatitis in general. So when it comes to the causes and pathogenesis, the pathogenesis itself, as already mentioned, it is autodigestion of the pancreas. So when the pancreatic enzymes digest the pancreas. Very, very important, and that's why I'm just mentioning it again. It's very, very important to remember this. And because it's a positive feedback mechanism, not really positive feedback, but because trypsin can activate other proteases, it's very easy to see how this can be a very destructive process, and how once it starts, it can be very, very dangerous. So, and there's also injury to acinar cells, and there can be impaired secretion from the pancreas. I put this image so that you remember autodigestion of the pancreas by the pancreatic enzymes. Now let's talk about the causes of pancreatitis, which is definitely very, very important. There are many questions about this in exams, and it's also important for you to remember as a doctor. So the mnemonic I get smashed can be used for us to remember this. So first off, idiopathic, which basically means we don't know. There could be some mysterious causes. Gallstones, which together with ethanol, alcohol, are the main causes of pancreatitis, or at least acute pancreatitis. Trauma, uncommon, but it can happen, I guess, if someone stabs you in your pancreas. Steroids can cause pancreatitis. Mumps and malignancy can also cause pancreatitis. There can be certain autoimmune conditions or autoimmune destruction of the pancreas itself. Scorpion stings, which are definitely the most interesting out of these potential causes. That's why I put an image of a gigantic scorpion from the movie Clash of Titans, I think it was, just so you don't forget scorpion stings can cause acute pancreatitis. Hypercalcemia or hypertriglyceridemia can cause acute pancreatitis. ERCP can cause acute pancreatitis. ERCP is a procedure usually used to remove gallstones, and it stands for endoscopic retrograde cholangiopancreatography. We have a video on gallstones where we talk more about ERCP. You can definitely have a look. And also drugs. Certain drugs like sulfa drugs, protease inhibitors, among other drugs, can cause acute pancreatitis as well. So definitely look up these drugs and have them in mind, especially for your exams. All right, now let's talk a bit about the pathology itself. We're going to talk only about the two main causes, which is alcohol-induced and gallstone-induced pancreatitis. So alcohol causes pancreatitis, acute pancreatitis, in two ways. The first one is making the pancreatic fluid itself very, very viscous and thick, which can cause the blocking of some pancreatic ducts, and they're in subsequent causing there's distension as well. But it can also lead to early activation of zymogens. So the zymogens are these enzymes that, like trypsinogen, which then need to be activated in order to work. So in other words, it can cause trypsinogen to become activated into trypsin a bit too early. And this usually means inside the pancreas, and then the autodigestion happens. So again, because it's very viscous and very thick, the fluid, it can cause obstruction and distend the bile ducts. And also the zymogens being activated too early can cause the autodigestion of the pancreas. Another two ways in which alcohol can damage the pancreas and cause acute pancreatitis is through reactive oxygen species, which can then damage the pancreas, and a localized autoimmune response. It can end up releasing some autoimmune signals, and that can end up damaging the pancreas as well. Now, when it comes to gallstones causing acute pancreatitis, this is mostly because the gallstone itself can become lodged in the bile duct, and this can cause obstruction and distension of the bile duct. And the stagnation, distension can lead to also activation of these enzymes, so activation of the zymogens while they're still inside the pancreas, which again would cause the autodigestion of the pancreas. And pancreatitis can present with a few signs and symptoms that you should really watch out for. So nausea and vomiting. So this patient's going to be excruciating pain, and many times it can be vomiting as well. So epigastric pain, and this pain can several times radiate to their back. So if a patient comes and they're vomiting, they're a severe alcoholic, they're vomiting, they have this strange pain in their epigastric region, which is radiating to their back, they should raise a few eyebrows and maybe consider acute pancreatitis. This pain is very, very severe as well. Another sign that you could find if you did a blood exam is that there could be hypocalcemia. We're going to talk more about this later. This could be because of fat necrosis of the pancreas. So if there's fat necrosis, there's going to be some free fatty acids. Then calcium and magnesium can bind to these free fatty acids and lead to what's called saponification. Sabão in Portuguese means soap. So saponification is basically you're creating soap in your pancreas, which is very strange to think of. But yeah, the patients can be hypocalcemic, but yeah, definitely watch out more for the epigastric pain. And they can also have what's called the Cullen sign and the Gray-Turner sign. I'll show you an image of what this looks like in a second. But not all patients with acute pancreatitis have these signs. These are really not present in all patients. And they look like this. So Cullen sign is this bruise near the belly button. And Gray-Turner sign is this massive bruise near the flank area. So this is more on the side of the patients. And from what I read, this means that there's been a retroperitoneal bleed. So if you find this, don't assume it's pancreatitis straight away. Apparently, from what I read, it could also be a burst ectopic pregnancy. But yeah, in exams, this is something that they can sometimes ask about, or they can describe a bruise in these regions, which could make you think acute pancreatitis. Sorry, I had to remove my camera for this slide just so you can read the very end here. But just a quick note on the severity of pancreatitis. It can be life-threatening. Most cases are not, but it can be life-threatening. And within the first 7 days, what you should really be watching out for in someone with acute pancreatitis is systemic inflammatory response syndrome. This is characterized by temperature either above 38.3 or under 36, heart rate above 90, respiratory rate above 20, and white blood cell count above 12,000. And the way I think of this is, it's not really, but it's almost like sepsis without the infection. So it's your body going a bit crazy with everything that's going on with pancreatitis. There can be organ failure, there can be hemodynamic instability, and during these first 7 days, what's most likely to kill the patient is respiratory and acute kidney injury. So we're going to talk more about this later on in the complications slide. But after 7 days, it's mostly due to other complications of acute pancreatitis, such as sepsis or hemorrhage. So you can imagine that it can be very severe, but many cases could maybe just be very not life-threatening. And for this, there's a few scoring systems that can be used to predict the severity of disease. The first one, which you can find online very easily, is the Glasgow and Ranson scoring system. Again, you can just search it up and look at what they exactly they evaluate. Or also the acute physiology and chronic health evaluation score. And these can be used to predict the severity of the disease itself. All right, now let's touch a bit on chronic pancreatitis. So chronic pancreatitis is chronic inflammation, atrophy, and calcification of the pancreas. And it can have a few complications, and these include pancreatic insufficiency. And this will present as staturia, so you won't really be digesting and absorbing as many fats. Fat-soluble vitamin deficiency, again, it's one of the functions of the pancreas to produce lipase and colipase, and those are important in fat metabolism. But also diabetes mellitus as well. Again, it's pancreatic insufficiency. Your pancreas isn't, because of extensive damage, is not being able to work as well. It can cause pseudocysts to develop. We'll talk more about these later. It may also cause, this is what I found very interesting, it can also cause splenic vein thrombosis. This is slightly more rare, but because of the location of the pancreas, this inflammation can cause thrombosis in the splenic vein, and this can eventually even lead to a stomach and esophageal varices, which, as we know, is a formula for disaster. So definitely watch out for that. If someone has an enlarged spleen, gastric bleeding, and recently has chronic pancreatitis, maybe consider this as a potential diagnosis. And something that's interesting about chronic pancreatitis is that amylase and lipase might be normal or only mildly elevated. So while they're very, very important in the diagnosis of acute pancreatitis, they might not be as important in the diagnosis and management of chronic pancreatitis. Right, so to diagnose acute pancreatitis, there's three main criteria, and the patient has to meet two of them. So the first one is acute epigastric pain radiating to the back. So it's the pain that we described as usually very severe. Increased serum amylase and or lipase. Usually amylase is tested more in hospitals just because it's cheaper, even though lipase it's actually more sensitive to diagnose pancreatitis. And usually these are in the 3 times the upper limit of normal, so they're quite elevated. And it can also have characteristic image findings. And these are usually a CT. CT is one of the best ways to see the pancreas. If you ever saw a normal abdominal x-ray, it's very, very hard to see the pancreas, at least for me. And here's a CT showing someone with acute pancreatitis. You can see that there's a lot of swelling around the pancreas, and the pancreas looks a bit bumpy as well and swollen. So yeah, definitely watch out for that. So again, I had to remove my camera just so you're able to read everything that's in the slide. So now let's talk a bit about the complications of pancreatitis. This is very, very, very high yield for you to know because, well, these complications play a major role in how you're going to manage your patient and what you should be looking for, because some of them can be deadly. So the first one we're going to talk about is DIC, which stands for disseminated intravascular coagulation. The name itself basically describes the condition. So it's sometimes called a consumption coagulopathy because it's basically where you have so much clotting that you end up using up a lot of your clotting factors. And it's a mixture of having too many clots and not being able to clot enough because you used a lot of those clotting factors. And it can be very, very dangerous. So watch out for that. Patients who have an elevated PT, PTT, patients are going to have thrombocytopenia, as well as microangiopathic hemolytic anemia, which is caused by the tiny thrombus in tiny vessels that can break down red blood cells. So very, very dangerous condition. They can have what's called acute respiratory distress syndrome. This is most likely one of the reasons that they could die from. This is very, very severe again. And it's caused by damage to capillary and endothelium and it's caused by damage to capillary endothelium and the alveolar epithelium, and this can cause just basically damage to the lungs from acute pancreatitis, and it can be deadly. Again, the first 7 days, this is more likely to be one of the reasons that kills them. Pancreatic pseudocysts can also form, and the main problem with these is that they can create fistulas and or they can rupture. And when they rupture, they can actually cause peritonitis, which is very, very serious. So yeah, pay attention for these pseudocysts. And these pseudocysts can actually become infected. Like the complications don't stop, but they can become infected and lead to a pancreatic abscess. And these are usually from gut bacteria, so the gram-negatives such as E. coli, Klebsiella, among others. And that's a lot about, and that usually highlights some of the reason why we give antibiotics as prophylaxis for someone that has acute pancreatitis. There can also be fat necrosis of the pancreas, and the main problem with the fat necrosis of the pancreas is, as described previously, this fat necrosis can release triglycerides into the bloodstream or just release them in general, and these can bind to calcium and magnesium and end up causing hypocalcemia and hypomagnesemia, which can have complications of their own. And it can also cause hemorrhage. I'll talk a bit about the blood vessels in the next slide, but this is due to inflammation and erosion of major blood vessels near the pancreas. If you look at this image, you can see that the pancreas is surrounded by several important arteries. And if there's severe inflammation of the pancreas, many of these arteries can become inflamed and eventually they can even rupture. So these can include the splenic artery, which can be seen right here, the pancreaticoduodenal artery, which can be seen right here, the superior pancreaticoduodenal artery and inferior pancreaticoduodenal artery, the gastroduodenal artery, which can be seen here, gastroduodenal artery, and the gastroepiploic arteries, which you can see here, the right gastromental or gastroepiploic artery, and here you can see the left gastromental or gastroepiploic artery. So these can all be affected and even cause hemorrhage if someone has acute pancreatitis. So the treatment of acute pancreatitis is, first off, pain management. These people are going to be in excruciating pain. Their pancreas is literally digesting itself. So give pain management. Fluids as needed. There's gonna be a lot of swelling, a lot of edema around the pancreas, and sometimes people can literally get so much fluid and still be fluid depleted. So watch out for fluid and give it as needed. No food, so this gives the pancreas some time to rest. So this usually don't eat food through their mouth for 2 or 3 days. Oxygen if they need it as well. And many times you can give prophylactic antibiotics. A lot of it is due to complications, so the person's going to be very weak, the person's going to be very sick, and they can have pancreatic cysts, pancreatic pseudocysts, which can become infected. So yeah, remember just pain management, fluids, no food, oxygen as needed, and antibiotics if needed as well. And as a summary, acute pancreatitis is autodigestion of the pancreas. I know I mentioned this several times, but it's just to help you remember. If you remember this, everything becomes kind of straightforward. So autodigestion of the pancreas. Remember the causes, very important. I get smashed. The main ones are gallstones and alcohol. Treat usually with no food, so NPO, fluids, pain, and antibiotics. Sorry, don't cause them pain. Give them pain management. They're going to be in excruciating pain. And also give prophylactic antibiotics. And watch out for acute respiratory distress syndrome. They can die from this. Watch out for disseminated intravascular coagulation. Again, very serious. And other life-threatening complications of pancreatitis. So yeah, thank you very much for watching. I really appreciate it. Leave a like, leave a comment. Tell me how I can improve as well. I always enjoy feedback. And yeah, thank you very much.